afternoon, and welcome to your weekly medical town hall here at TRICARE, the center of the aerospace testing universe. If you are tuning in for that very first time, I am Gwendolyn Foster, your medical group commander, and with me today I have Captain Lankard, our public health officer, Major Thornton, our bioengineering officer, and Lieutenant Vallows, our TRICARE operations officer, and also, as always, my right-hand woman, Chief Bradley. So as you're seeing that number flash across your screen, please start sending us your questions, because after we give you our weekly update, we want to get to giving you those answers. And with that, I'm going to turn it over to Captain Lankard for our weekly update. Captain Lankard.
Awesome. Thank you for joining us all this week again. If I could have the slides be put up, please. All right, so this is going to be your situational update as far as COVID-19 in the U.S. and California. The bottom left chart is the same as we saw kind of last week, but more states have been added to the increasing cases. Basically across the board, we've been seeing increasing cases in many, many states. Right now, there's about 24, up from like 21 last week, that are seeing increases to their reopening plans, partly due to personal behavior, which is really the linchpin of the entire COVID response, is taking that personal behavior and adapting it to this new environment. What I really wanted to highlight today is that middle graph. So that's actually going to be California's COVID-19 cases, and they're actually spread out by age group. And it's really pretty interesting because the cases in California are actually getting younger. So the older cases, as the months go on, each of those bars is a different time period. But basically, it's showing that the burden of the disease is kind of shifting more towards the youth. So younger folks, really in the like younger than 34-ish bracket. So there is that we're seeing partly that trend due to the behaviors, again, because people want to go out, teenagers want to go hang out with their friends, college age kids want to go and just hang out, be social and stuff, and we're really starting to see a negative trend of those behaviors not being followed as COVID kind of goes on and as the states release their restrictions, and that's kind of the age group we're really looking at more so than the older folks. In addition to that, the highest number of new cases were reported in a day in California most recently. It was actually about over 2,000 cases. So that's pretty distressing in our own backyard, essentially. 600 of those were from a backlog. That's kind of disturbing because that was 600 cases that were already in the community that we weren't accounting for. So it's here, it's staying, and it's not getting better, essentially. So it is starting to get worse as far as case counts go. Next slide, please. So this is going to be the trend in our absolute local area backyard. So that's going to be Lancaster, Palmdale, Tehachapi, Roseman, Cal City. It's the basically teased out LA County because this is where most of our folks really reside and live. So you can see we kind of went down there for a little bit, but this is our 7-day average trend. So this is basically adjusting the average of cases over the past 7 days. So it's a sharp increase right now. We're hoping that it's just another one of those little hills like we saw earlier, but all indications are that it's not necessarily. Lancaster and Palmdale specifically have went up by double the cases they did the last town hall are doing, because right now LA County is going into stage 3 reopening. Basically the state of California is on the right, so you're going to see more of those facilities opening up, and it really honestly is up to the individual to make sure that you are keeping yourself safe, because those facilities might not be doing everything they can to protect you, even though they're supposed to. So just as the summer goes on, as things keep opening up, regardless of what you see, please keep practicing those good anti-COVID behaviors, because that's really the only thing that you can honestly do to protect yourself and your family as an individual. Other than that, I don't like to be the bearer of grim trend lines, but that's pretty much where we're at this week.
All right, thank you, Captain Lankard. Next slide. All right, so as you know, this is your weekly service slide. So we're still hanging steady at our services that are green, but there is no red. So once again, all our doors are open between virtual and face-to-face. So please make sure you call that appointment line for whatever service you need, and we'll make sure you get to what you need, because we always want to provide that trusted care anywhere and anytime. We also continue to keep that over to bio for a bio update. Next slide.
Good afternoon. Just wanted to basically admonish everyone to continue to wear your face covers. It is a mandatory per wing policy. And unless, of course, you are performing a task at your job which requires a respirator, then please wear your respirator. And if you have any questions or concerns, please reach out to Bio. We're here and happy to help. That's all I have, ma'am.
Thank you, Bio. And now for our TRICARE operations update with Lieutenant Vallows. Next slide.
Thank you, Colonel Foster, and thank you again for inviting me here to speak about some TRICARE operations and patient administration. So this week into 6 simple steps. So the first one, step 1, is with the patient administration to get that review, or you can call the Referral Management Center at Edwards Air Force Base to get that information verified. But it is very important that those demographics are accurate for billing purposes and for HealthNet to even authorize the referral. So moving into step 2, it's now been 3 to 5 business days. Your authorization, you're going to go check to see if your authorization has been authorized and approved by HealthNet. And there's 2 ways you can do that. There is the TRICARE-West.com portal that any TRICARE patient can go into and see their authorization, see who they were referred to, and if it's authorized. The other way, if you'd prefer to stay away from the internet, provides you the status of your authorization and who they are referring you to for specialty care. One thing to note about step 2 is a couple of things. If you see that a provider on your auth letter is not necessarily the provider you would like to see off base, you do have a right as the patient to you have a smooth specialty care appointment, and that off-base provider has that authorization in their hand. Which brings me to my next point. Make a copy of your authorization and bring it with you to your appointment. There are always technical difficulties happening every single day. So if you want to for sure bet that your care is going to be taken care of when you're at your off-base appointment, bring a copy of your authorization letter. And we'll go into that more on the next slide. But going into step 3, now you're at the point where you know exactly what provider you have and you're ready to book. And for any of you who have received a referral from our mill, provide that information to us so we can put it into the system that communicates with that automated phone call. Once it's in, it's turned off until your next referral. So going straight into step 5 is simply just going to that off-base appointment. And in non-COVID times, when we have that face-to-face appointment, our providers should be handing you a couple of resources to help you through the process. And one of them is this red card you see here on the screen. So this red card is really helping us get your results back from that off-base provider in a timely fashion and making sure that off-base, with the virtual appointments right now, if you have a referral, I don't think we have this in place yet with the virtuals, with handing out the red cards to our patients. But if not, in normal face-to-face, please hand that red card to your off-base provider so that they know that you care about your own health care and also that we're getting the results back in a timely fashion. And then step 6 is simply the PCM team being able to follow up with you. And without step 5 of getting your results, we can't do step 6. So going into the next slide is pretty much a breakdown of how to understand your authorization letter. So if you do print off your authorization letter, it does have a lot of information on there for you. First, I highlighted 3 most important items of that authorization letter. The first item is who your authorized provider is, and that's highlighted in blue. So that is going to be your off-base specialty provider that you can call to book your appointment, and it should have an address as well as their phone number there. Going down into the pink, item number 2 is where you're going to find the expiration dates for that specific visit. So the first visit on the top line is always going to be that initial intake visit, and that's why in item number 3 you're seeing number of visits, number 1, because there's only going to be one initial visit. So just making sure you're tracking the expiration date on the type of visits is very important, and making sure you're getting that initial visit in before the expiration date. And the numbers below it are those follow-up visits for that treatment that specialty care provider can provide to you based on that referral. Going off to the right of the slide, the if-thens, is also very important for you to know as a patient, because a lot of times our patients kind of get caught in between this. So it's good for you to know, so you kind of know what's going on. But if that referral is not expired, then that civilian, let me retract a little bit. If that referral is not expired and you or that civilian provider want or need more visits, especially for physical therapy, or they want to refer you to a subspecialty care program, then that civilian provider is responsible for submitting that request to HealthNet. The civilian provider has their own HealthNet system to submit referrals for situations like this. So again, if it's not expired, that civilian provider owns that referral to get you to the next place. On the opposite side, if that referral is expired, that's when you are going to encounter that civilian provider advising you to go back to your PCM to get reevaluated for a new referral, and that's when you would call the med group appointment line for a reevaluation of that referral. And then lastly, at the bottom of the slide there, I kind of put a step by step on how to print that authorization letter that you see there. So that concludes the referral process. And then the next slide is really just the slide that I owed you from last week's town hall with that patient admin customer service line, and also the services that we're reopening, and kind of a brief explanation about what they are and how to go about getting those services. And that's all I have today for the TOPA topic of the week. And back to you, Colonel Foster.
Thank you, Lieutenant Valos. And last slide, please, before we get to those questions. Oh, you have one more.
I do, or not.
All right, so before we turn it over to your questions, again, we could not be here really trying to flatten that curve without your support. So as you heard Captain Lankert say, with everything that's going outside our gates, we really need to get after those behaviors. So we need to know the threat, respect the threat, so we can beat the threat. So continue to practice that safe physical distancing, that covering your cough, that wearing your mask when you need to, if you can't stay within that safe physical distancing, because all of that counts. And if you see those not doing that, that doesn't mean you need to partake in those non-COVID-like behaviors, because that's the only way that we are going to be able to truly beat this threat of COVID. And with that, now we're going to turn it over to Chief Bradley so we can start answering your questions. Chief.
Major Angela Thornton, our bioenvironmental engineer. We have Captain Aaron Lankard, our public health officer. And we have Lieutenant Victoria Valos, our TRICARE operations and personnel administration expert, patient administration expert. So TOPA for short. So you can text your questions in on the number on the screen, and you can also post them on Facebook. I'm monitoring both just to make sure we get your questions answered. And our first question today that we had texted in is, do we know how mask wear has impacted asymptomatic spread of the COVID-19 virus? Captain Lankard.
Yeah, basically surveillance system to know who at any given time are we going to be expected to actually be asymptomatic. So because we don't have that whole site picture, it's going to be kind of harder to kind of determine A, the asymptomatic spreaders, and then B, how much mask wear has actually helped for them to not infect people if we don't know who they're actually infecting. But there has been some data coming out, especially now the nation generally, I mean, it's not necessarily everywhere, but generally the nation pretty much went on a everybody wear masks policy. Because of that, there are some anecdotal situations where they believe that it really has helped more than originally expected. So masks are not supposed to be preventative. They're not supposed to be like a COVID shield. They're really, really designed to make it so that if I'm going to sneeze into my mask, it's going to at least capture some of it, so it's better than nothing type measures. So it is a good thing. You should protect yourself. But again, the data out there right now is not really solidified on how much it truly helps symptomatic spreaders, let alone asymptomatic spreaders. However, there was a situation, I know that in Texas, where there was two hairdressers, I think it was Texas, where there's a couple of hairdressers. One showed up to work sick, and all the customers wore masks, and no one ended up being a case of COVID from that. So the CDC is actually looking at that and being like, hey, we really do think this actually helped in this situation. So short answer is we really can't quantify how much it helps. We do know that it can help, and so far there's not really concrete data as far as it helped X% or Y%, because it really depends on, all right, how thick is your mask? What's the material made out of? Are you actually washing it? Are you doing a bunch of stuff? So there's a lot of factors that really go into it. But basically the overarching idea is, now that we are seeing more situations of mask wearing in the United States especially, we're starting to get a better idea that, yeah, it really is a preventative barrier that is helping. But again, with asymptomatic spreaders, we really don't know what percentage of the population for sure is, and let alone how much infectious they really are, versus the obviously contagious ones that are going to be coughing and doing a bunch of gross stuff like that. So, yeah.
Thank you, ma'am. We had another question texted in. The DAF memorandum states a downward trajectory of cases or positive tests as a percentage of total tests over a 14-day period is a
data is. So because of that, because we take that so seriously, and data integrity is so important, especially in this type of situation where it's basically an unknown threat. What we do is we get the data directly from the counties themselves. So we go straight to the source. We look at the press releases. We look at the dashboards. Kern County does the same thing. We basically look at those two, and then we look at the state of the California as well as a cohort. Most of our data is going to be looking at the local area, since that tends to be more mission impacting, and really be Edwards specific. So like all the graphs you see that we present that's specifically made for Edwards area is taken directly from the health departments, directly from the source, which is also why we get into situations where they say, oh, hey, there was a 600 case backlog. But at the same time, we use that to say, hey, it's in the community even more than what we thought. So that's kind of what we look at as far as the local area goes. The state itself, we look at the reports directly from the state. So we don't really necessarily go to outside data sources for that. We try to go essentially right to the source to make sure what we're reporting is directly what the state, what the counties are both reporting, cities as well, because all the cities are actually shredded out on LA County's press releases when they give all the COVID cases. All of it's there, and it's information directly from the counties themselves.
Thank you, ma'am. Lieutenant Valos.
Yeah, I can add, even on top of that, additionally, our patient place that have been in place for months now of getting the bed availability, getting the number of COVID patients that they're seeing, whether they're active duty or not, just generalized numbers that are in relation to COVID-19, so that we can better our data, and we report that to our medical emergency manager every single day with that information to obviously validate some of the numbers and make the numbers stronger for this town hall and for reporting purposes to leadership, to make sure Edwards is staying safe and we get a better picture of our community.
Thanks, Lieutenant. All right. We had a couple of questions that we missed over the last couple of weeks. We will answer those now, ask those this summer. Can I quarantine with him in our home? Captain Lankard.
Yeah, so actually this is a really good time to answer this, because originally we answered it before more information came out. So just so everybody's aware, the Air Force is constantly updating their procedures, pretty much just as often as you see like the federal government, the DOD, is what's going to happen when he comes back. As of today, at least, and this could always change, but as of today, what's going to happen is all deployers coming back from overseas, when they in process with my unit, so they're going to be screened. Basically, we're going to ask you, hey, what were your exposures like overseas? What was your plane ride like? Did you have any significant exposures? Do you think you came in contact with anybody who was sick? What was your base like there? Did you have any cases? Did you do X, Y, or Z? Are you feeling okay? Questions like that. Did you sit next to somebody that was coughing on you on the plane? Things like that, to really get an idea of, hey, how are you doing? What were your exposures? And then go from there. It's kind of similar to what we do to anybody that kind of talks to our unit about, hey, I think I was exposed to COVID. We do that investigational screening, basically. So we'll do the same thing with deployers. just like anybody else, if it's indicated that, hey, you probably should be quarantined because you've had a close contact or you've had some sort of exposure, or it's kind of like unsure, we'll work with the docs to make sure we give a good recommendation on those situations. Then that we would recommend a quarantine. Most likely, most people are not going to necessarily need to quarantine, but again, they'll just go through the same screening just when they come into the unit that anybody would that would be coming from essentially overseas or having some sort of exposure. So that being said, if your husband did quarantine, you can absolutely quarantine with him at the home. The whole idea of quarantine is that you're not necessarily sick. We just don't know what your exposure is, so you might become sick. So we want to make sure you're out of the general population on the off chance that you do kind of pop positive and you start getting sick and getting symptomatic and becoming a really infectious source. So yeah, you can definitely quarantine with them at home. The recommendations there are just going to be like, hey, make sure you guys wipe down stuff in between uses. So you shouldn't be using the same utensils that your husband is, just to minimize that on the off chance that he does end up getting sick. It'll minimize your chances of being sick. So you can definitely still be around each other. No big deal there. Just your husband would end up not being advised to go into like the gym or base population and really follow the normal quarantine procedures. But there's no issues with, you guys don't have to live separately unless there's some indication that you should because you're either high risk or anything else in your personal situation. So
Thank you, ma'am. All right, the second question that we had come in was, can you offer how, this one's actually a two-parter. Can you offer how we can protect ourselves at grocery stores, churches, barbers as California relaxes their standards? Again, stating that masks are not defensive. So how do we protect ourselves? And then can vitamin C help prevent getting sick from the virus?
Captain Linkert.
Excellent. So that's a really cool nested question. To the first bit, as far as how to protect yourselves, it's going to be the same thing that we preach basically here every single day. You want to make sure that you stay away from people, because people are honestly the infectious source. You don't know who has it. You don't know who doesn't have it. There's always that possibility of asymptomatic carriers, all that good stuff. But your biggest threat is basically going to be other people congregating and other people not following the same procedures. So if you're wearing your mask, cool, you're protecting other people from you. If they're not wearing their masks, though, they could still just cough and do gross stuff and possibly be an infectious source. So what I would recommend, especially as things are changing and the different things are opening up, is if you're going to go to a place that's like in the community, maybe check in with them, either give them a phone call, look on their website, whatever. We're doing that. I'm personally doing that if I want to go to a certain location. See what their procedures are. So ask them like, hey, what are you guys doing right now to prevent COVID? If they're saying, oh, well, we don't have to do masks or we don't have to do whatever, or if anything about their response seems kind of inky from you, to you, again, it's going to be a lot of that personal risk assessment based on everything you've learned at the town halls, everything you've learned from the primary sources like CDC, all that good stuff, to really make that assessment and be like, I don't really think they're doing what they're supposed to do. And then obviously if you get there and they're not doing something that is in line with what they're supposed to be doing, so if they're just allowing anybody in the store, it's all congested, stuff like that, maybe reconsider going out to there. So there are ways to do it, and there are ways to do it properly. And I know the LA County, at least, I think the state of California as well, has the actual guidance they're giving out to all these workplaces to do so safely. But as mentioned, some places won't necessarily be doing it. I've heard anecdotally, again, from Kern County, they've released a lot of their restrictions prior to LA County, and if you go up there right now, there are some places where they're just not even wearing masks, and they're just kind of doing business as usual. So those types of situations are definitely what you're going to want to avoid. Unfortunately, a lot of the personal behavior is going to be based upon what the actual businesses themselves are doing. So it's really taking that risk of saying, all right, what are the situations here? What could I be at risk from? Is what they're doing enough, and do I feel comfortable? And if you ever don't feel comfortable, you just avoid that place, maybe do whatever it is at a different location. The base facilities specifically are all being vetted by public health, and so if you have base access, everybody at FSS right now is in close contact with us to make sure that all their procedures are as stringent as possible as far as minimizing that COVID. So that would be one recommendation. But again, just call ahead, maybe check their website, see what they're doing, see what their procedures are, and then obviously take your own behavior into account as well. Wear that mask, social distance, bring hand sanitizer. If you don't have access to soap and water, you still wash your hands. But if you don't have that access, carry that type of stuff. And then obviously get out of situations if you don't feel comfortable or if it changes for any reason. To the second question for vitamin C, so vitamin C itself has not been seen as a big COVID prevention thing. However, that being said, basically the best way to prevent nasty side effects from COVID is to be healthy. It's just have a nice balanced diet, get all your vitamins and nutrients, follow whatever your doctor says for your specific health situation. Make sure any chronic diseases are as controlled as possible. There are vitamins and supplements that can help be part of a balanced lifestyle. So, I mean, it sounds like it's like the simplest answer, like there should be some sort of silver bullet or something else. It's like an anti-COVID thing, but it really is making sure you get that exercise, making sure you get some fresh air, you get that good nutritious diet, and you're as healthy as possible so that if you do have the chance of possibly contracting COVID, the effects of it are going to be much more likely to be very minimal than, say, if you were in ill health or if you had any other pre-existing conditions. So that would be what I would say, is make sure you just consult your doctor and be like, hey, what should I be doing anything different? What else can I do to help keep myself healthy? And again, it seems super simple, but it really is the simple thing that can go the longest and really help to prevent any negative side effects from contracting COVID if that was to happen.
Thank you, Captain Lankard. All right, this question is for Colonel Foster regarding dental operations. When will annual dental cleaning start back up for active duty? Off-base dental facilities are up and running, and active duty only get one cleaning visit per year already. It would be nice not to have to wait until there is a problem to get a cleaning.
Yes, ma'am, and that is a good question. So our dental team is actually looking at that, seeing what they can bring on during HPCon Charlie. So as we're getting back to that return to full capacity, they have already started opening up more services. So they are looking at that routine exam for our active duty folks. So I will take that back, and we will have an answer either on Facebook or by our next town hall next week. Mm-hmm. But we are definitely looking at all our services, especially for our war fighters out there, to make sure that they are remaining fit to fight.
And I will add on to that, one of the requirements for them to really get back to seeing more patients is to get more people fit tested within the dental clinic on N95 respirators, because those dental operations really do expose our personnel to a lot of aerosolized respirable particulates, I'll say. And that is key to preventing our patients and then also our staff, as long as we get our personnel fit tested on that respirator. That's one of the points we need to hit before we can turn those operations all back on. So they're in the process of doing that right now.
And I will pile on a little bit, Chief, because we're also looking at the rooms where we provide those services. Because again, we want to make sure to keep those aerosolized particles as minimal as possible. So yes, thanks, Chief, for bringing that up.
Yes, ma'am. All right, so we've got a little bit of a lull right now in the questions. I did have one person ask on Facebook. We did answer it there, though. For virtual appointments, for somebody who's working full-time off base, are they able to still schedule a virtual appointment when it would be sorry, lost my words, when it would benefit their schedule? And absolutely. So easiest thing to probably do is send a secure message to your provider to kind of explain your situation, and we will do all we can to try to schedule that virtual appointment to meet your needs. And once again, you can text your questions in to the number that's on your screen. You can also message us on Facebook, and we will address your questions. We have our TOPA officer here, bioenvironmental engineer, public health officer, and medical group commander, all here ready to address those questions.
And I'll pile on a little bit, Chief, about those virtual appointments, and you can make that right online. I did receive a question today about that. You go to TRICAREonline.com, and if you've never used it before, all you have to do is register, and once you register, you'll actually start getting texts and emails as far as appointment reminders. You also can send secure messages to your PCM, so it is a worthwhile thing to do to register. And Lieutenant Valos, did you have anything else you want to add to that? She's smiling over here.
Yes, about TRICARE Online is like I said last week, just a lifeline of patient resources. So from the TRICARE operations patient admin side, that your entire medical record, electronic health record, is on TRICARE Online. So if you need a copy of your labs, your immunizations, the notes from your visit with your PCM at Edwards, anything, it is all on there. So if that off-base provider needs a copy of your labs for a specific appointment and it's last minute real quick, you can pull it up on your phone and it's right there. Your medical record's right there. You just have to remember your username and password. I forget mine often, so I use my CAC to log in, but it's all there. Of course, the secure messaging part, so you can set that up. I've used that in the past. You send a message to get associated with your provider. Someone on the clinical team approves it the next day, or depending on what time of the day, and boom, you're in communication with your provider team. It's that simple. So definitely utilize TRICARE Online. There is tons of resources in there for you as a TRICARE beneficiary. And as looking in the future, when we switch over to Genesis, there's also a Genesis patient portal that's also going to have those same resources. So get used to the TRICARE patient portal now, and it's going to continue in the future as well. It's not going away. So yes, ma'am.
Thank you, Lieutenant Valos.
Thank you. We had a question come in. Now that the governor of California ordered that all people must wear masks, does that apply to base or is that separate? Captain Linker, did you address?
Yeah, I can absolutely do that. So base already has its own mask policy in place that is pretty much in line with the state of California, where if you're within that 6 feet of distance, you need to be wearing a mask, especially if you're in like a social setting. Now, granted, again, as masks go, that 6 feet is not a solid number. It's not like COVID just stops at 6 feet. It can spread shorter, it can spread farther. A sneeze tends to go farther than 6 feet a lot of the times. So just really use that good judgment. Absolutely, if you're within 6 feet, you should be wearing your mask, just like how the state is doing it. At the same time, if you're sitting in a room with somebody, even though you're 6 feet away, but you're in that room with them within like 10 feet, or it's completely arbitrary, but if you're in a small room with somebody for like hours, even though you're far apart, you're still in that more or less confined space. And that's why the risk can kind of be super subjective. And that's what my office kind of works with a little bit, is like, all right, what's your actual risk? What do we really think versus the behaviors and all that type of stuff? So when in doubt, wear your mask, as long as it's safe, just like how Major Thornton said. If you have to wear a respirator or something else for your job, or it would cause breathing problems and stuff, you don't need to wear it at that point. But that being said, base is basically in lockstep with the state as far as this is what our mask policy is. This is what it entails. That's why you have to wear it if you go in the commissary, BX, these places we already know is really difficult to social distance. So just want to kind of foot stop that. That's why those ones are specifically designed to be mask wear specifically there. And then all else is going to be based on personal responsibility again.
Right. So if you're coming on base, have your mask.
Yep.
All right. One question that we weren't able to fully address last week was regarding the smallpox vaccine. So if an active duty member is PCSing, will they still be administered the smallpox vaccine? Captain Lankard?
Yeah, I believe that the most recent guidance is that they will not be getting the smallpox vaccine. So for active duty members specifically, they've started to hold off on that. We haven't heard anything recently in regards to it. So specifically for active duty members, it's pretty much a stop on the smallpox vaccine.
All right. So with that said, we haven't had any other questions come in yet. I'd say you still have a minute or so to get those in. As we can stick around till 2:30 if needed. But does anybody have any? Oh, there we go. Let's see. All right. The heat is kicking up, and with a mask on, it is hard to breathe. I understand. Given a medical condition such as asthma, is it my right to enter a building without a mask while maintaining my HIPAA privacy by refusing to disclose my condition? This is true off the installation. Is this true while on the installation? So definitely you've got a medical condition. You don't want to disclose that condition by refusing to wear it. But if you're refusing to wear a mask, you'll probably be asked some questions. I'm going to turn this over to Lieutenant Valos for hopefully her HIPAA expertise.
From a HIPAA perspective, you have a right to your own medical information. You own that. So you pretty much hit the nail on the head, or whatever that saying is, of if you're not going to wear your mask because of a health concern, you're more than likely going to be asked why or asked to wear it, and you may or may not have to disclose it just for the ease of that conversation, unless you want to start a little dispute there. But yeah, if you, all in all, HIPAA law, your medical information is your own privacy, so what you disclose is yours as a patient.
And I would also, with that question, I think reaching out to your PCM, because your medical condition, as you've heard Lieutenant Salas say, as far as HIPAA, that is your right to keep it private. So if the question was asked, just saying I have a medical condition that does not, that requires me not to wear a mask, as long as we're keeping that 6-foot distance. But it may help to also talk to your PCM, because we may need to give you a letter, so that way if those situations come up, that you'll have that with you to avoid any confusion or miscommunication in that matter. So we will dig into that a little bit deeper as well, because we want to make sure we're protecting you, but also keeping the community safe as well.
And to foot stomp the whole, if you are not going to wear a mask, it doesn't mean that you can then come within 6 feet of other people. So if you have that medical condition where you cannot do it, especially if it's outside or something crazy like that, please make sure that you stay away from people as much as possible, preferably larger than 6 feet, because obviously going to those locations, if it's still hot and it's not good for you to wear that mask, that's understandable. It's just try your absolute best to stay away from people as a supplement, because ideally you'd be staying away from people anyways, because that's your number one barrier. Number two is going to be the mask and the hygiene. So yeah, as long as if you do go down that route and that's cool and that's all good, just try to still practice that social distancing, maybe be hyper aware of it, and that way you also probably won't even get as many questions, because you're just kind of doing your own thing in your own little bubble and stuff. So
yeah. Because also if you have that medical condition that requires you not to wear that mask, you're probably at higher risk to contract the COVID. So we want to make sure that you're staying safe as well.
And as always, consult with any facility that you do want to enter. If it is their policy that masks are required, do talk with them, because I'm not sure if that letter would let you pass or not. That would be up to the individual facility. All right, that is our last question as it stands now. Colonel Foster, are you ready to wrap up?
All righty. So again, I just want to say thank you for tuning in. The whole entire team thanks you. We are your medical group, and we are here to provide that trusted care anytime and anywhere. So thank you again for tuning in, and we will see you next week.